Emily, how are you?
I'm good. How are you?
I'm great. Your research is on ADHD. What first got your interest in this field?
As a therapist, I've always been fascinated by the human mind. I think specifically with ADHD, one, you just see it so much today. I also think that the world we live in kind of reinforces inattentiveness and a little more impulsivity because we have a lot of very fast-moving, fast-paced environments. We have a lot of scrolling on social media. And I just started to see it in my practice all the time, particularly in young females, but that's also a lot of who I see. So I think it's just something that people really struggle to deal with, and also something that is really just more and more common as time goes on.
So, can you tell me a bit about how attachment styles might connect to ADHD? Is avoidant or anxious more at risk for symptoms, or is that an oversimplification?
So, as you know, attachment styles are essentially the way in which your early relationships kind of form the way that you in the future form relationships with other people, kind of like a template for how you're going to relate to others. And so people fall into one of four categories. You have people who are securely attached, which is obviously what we're shooting for. And then you have people that are anxiously attached, who are more kind of preoccupied with what's going on with whether it's their partner or friends. You have avoidant attachment, which is people who kind of avoid things that cause them stress in relationships. And then you have disorganized attachment, which is a little bit of both of those two categories, avoidant and anxious. With attention, with ADHD, any sort of insecure attachment does increase the likelihood that a kid is going to have ADHD. It doesn't necessarily cause ADHD, but it might amplify certain kind of vulnerabilities that someone has or make symptoms much worse than they already were. I wouldn't say that there's one attachment style that necessarily correlates with an ADHD diagnosis, but all of them are correlated with some level of increased ADHD. You'll see with avoidantly attached people, you'll see more inattentiveness, people who disengage when they're stressed, like that will come across as someone who's struggling to pay attention. And then with someone who's more anxiously attached, you'll see what looks like distractibility, hyperactivity, impulsivity. So those are kind of the broad ways in which it's correlated. And then with disorganized, because you go in both of those directions, you might have someone that is showing both combined type ADHD with both hyperactive and inattentive symptoms.
Got it. So the way it's expressed is different, but there's not necessarily, if you're anxiously attached, you're more predisposed. It might be diagnosed more, but it's not.
Yeah, and you can't say if you're anxiously attached, you're going to have ADHD that's hyperactive. Like, it's obviously not a complete direct causation. It's just kind of like, that's going to amplify what already exists, or what hyperactive, like anxious attachment is going to amplify what hyperactivity and impulsivity and distractibility is already kind of present. So it's more likely, or it's more correlated with hyperactive ADHD.
If we think about focus in general, not just ADHD, what do you think helps someone stay focused outside their biology? Talk about their surroundings, their current relationships, or past ones.
I mean, all of that, right? I think if we're stressed, whether that's physiologically because we haven't had enough sleep or enough food, it's going to be hard to focus. If we have a really tumultuous relationship, that level of stress is going to make it hard to focus. Basically, anything that causes a chronic level of stress is going to impact our ability to maintain our focus and attention. So I think, think about it. If you were super hungry, it's hard to focus on what you want to do. It's hard to take a test if you're starving. I think it makes a lot of sense. So for someone, whether or not they have ADHD, kind of having those structured routines, making sure you're getting enough food, enough water, enough physical movement, it's definitely going to help with any sort of focus and attention.
Okay. Yeah, it makes a lot of sense. I've heard that people with ADHD can react to stimulants in a different way than others, sometimes feeling calmer. One psychiatrist described it as a litmus test for if a person really has it. If someone struggles with focus because of how they were raised or what they learned, how would they respond to stimulants compared to someone who has ADHD? Would it be different for them?
Yeah, I think with what you're saying, that's maybe in broad strokes, that's true. It's kind of a litmus test, right? Mm-hmm. But if someone who looks distracted, but really is kind of just maybe dealing with high anxiety or, a little bit of depression, a stimulant's obviously not going to be the right fit. Then you have the category of people who have ADHD, but also have another mental health disorder. About 60% of people with ADHD do have another mental health disorder. So if you have someone with comorbid ADHD and anxiety, that stimulant might make them more anxious. It will almost absolutely make them focus more. But on the whole, it might make them feel more on edge, more irritable. So it really is person to person. It's hard to say exactly what's going to be the right fit. Certain meds work differently for, some people like Vyvanse versus Adderall. Some people can't really take meds at all because it's not the right fit for them. And some people absolutely live and die by medication. I think it really is just kind of based on the unique person and their own kind of genetic and biological makeup.
That's a theme, I think, of kind of what we've been talking about.
Yeah.
Yeah. When it comes to children, are there certain ages or stages of interacting with them that seem to matter more when it comes to this thing?
Yeah, so almost about 80% of your brain development happens in the first 5 years of life, but particularly the first 2 or 3 are really important. That's where those kind of areas of the brain that are for attention and self-regulation are going to develop. So that first few years, having consistency in caregiving, having kind of, responsiveness to your child, warmth, making sure you're responding to them in a connected and grounded way, that's really going to be important. The brain does continue to grow up until age 25, but I think really those first 5 years, and then there's another, what they call the second window of opportunity in adolescence, where there's a lot of pruning happening in the brain. We're getting rid of the things that are no longer, basically, they say use it or lose it, right? If you're not using it, it'll prune. Your brain will no longer have those neural connections. And so it's really another opportunity to kind of, if you do have these attentional issues or if you're struggling with focus, adolescence is a great time to kind of try to build those habits that you haven't had and actually make changes in your brain that will ideally serve you in the long term.
Yeah. Okay. What are some of the early signs of ADHD? And does it look the same for everyone?
So ADHD is a very heterogeneous condition. So really looks different depending on the person, cultural background, gender, age. Some of the early signs, I think some of the most well-known ones, right, are going to be interrupting in class, being impulsive, not waiting for the teacher to call on you and raising your hand, the kids climbing trees and not able to sit still. But what gets missed a lot is kind of the more inattentive, where a kid just might be not paying attention, but they look perfectly, they don't look disruptive. They're kind of just silently not focused. And I think with boys and girls, this is kind of something that has played out a lot in the data. You'll see boys are much more likely to be diagnosed with ADHD, especially in early childhood, because they're more likely to show what we call like externalizing symptoms. So symptoms that are more outwardly disruptive, like impulsivity, like, climbing on things, whatever. But girls are often more likely to show internalizing symptoms, more inattentive symptoms, and therefore that can often be missed. But again, it is person to person, and I think it's kind of hard to tell, and some people it's really right there for you to see. So I think assessment is really important and kind of making sure you go through that process in a very in-depth and comprehensive way.
I have a client who said, Nick, I have ADHD. Am I like someone who's a little out of shape, training for a 5K, challenging but totally achievable with the right plan? Or am I more like someone with no legs wishing they could run? I imagine it's different for everyone, but I would love to hear your thoughts on that.
Yeah, overall, I think that's a pretty good analogy.
Okay.
Obviously, I don't want to beat a dead horse with this, but again, it is going to be very person to person, just like working out, right?
Okay.
Sometimes I'll have a friend that wants to get in shape, and after 6 weeks, they look different. And other people will try for months and months and months, and they don't see the change they're kind of looking for. With this person, I would definitely want to check in on the way he's kind of relating to his ADHD diagnosis. I think if he's thinking about it as something that's a handicap, that can definitely impact the way that his symptoms affect him. I think overall, yes, like just like anything else, our brains change in response to experience. So just like working out physically, if you exercise certain parts of your brain, if you try to sustain focus, starting a little at a time and building that up, I think your brain is going to change. Yeah, so I think while I wouldn't want to frame it as, okay, this is such a handicap, I do think even within that analogy, right, I think even you see people who are Olympians with no legs, right? They'll train their arms, they'll get really physically strong and be able to support themselves with their upper body. And I think no matter what you have going on, no matter what deficit is going on in your brain, what you might be missing, I think there are ways to improve that, especially when you kind of get to it early. But overall, our brain changes based on experience. If we actively try to learn to focus more, to actually sustain attention, our brain is going to develop in that direction. So we're going to kind of continue to improve and grow in that way. But this is like way more effective the earlier on you can get to it. So when you see a kid with ADHD, getting in there early with early intervention, whether it's parent training, physical activity, whatever, is really going to make a lot of change, because that's when the brain is more plastic, right? It's more plastic earlier on in life, up until like age 25, but throughout the lifespan. So no matter what age you are, you can change your brain.
So what can people do to help?
So there's a lot of things you can do. And I think, like I said earlier, everything from kind of nutrition, getting more sleep, like all of that is going to help in the right direction. Outside of that, obviously medication is a great option for a lot of people. I think shows to be about 80% effective. It's definitely very evidence-based to be a support for ADHD. But you also have things like parent training that can be really effective, especially in the first 8 years of life. So parents kind of learning how to relate to their kid, how to set up that kind of structure that's going to help their kid develop in the right direction. Executive skills training, obviously therapy. I think there's a lot of things you can do, but kind of figuring out what you're open to, what's going to work for you, and playing around with kind of the way to structure, whether it's your child or you yourself, kind of structure your or their lives so that things become easier for you. I think people kind of having these high expectations often gets them in trouble. I think it's a lot easier to say, okay, yeah, my room's really messy. I'm going to clean for 10 minutes. I'm not going to try to make my whole room perfectly organized. I think the more we make things achievable and, scale up over time, we're going to be able to kind of improve the way that we're functioning.
Yeah. How does ADHD impact social relationships?
Can definitely impact social relationships in a lot of ways. I think sometimes, for kids, they might be interrupting other kids. They might be not thinking about, if this kid wants to play a certain game and they're kind of not able to focus on what the other kid wants to do. They're not interested, or maybe they're super fascinated by a topic and they'll talk about that and not ask anyone else about themselves. So I think in early childhood, sometimes kids experience maybe other kids being confused or overwhelmed by their differences in social skills. I think as you get older and you kind of grow more ways to kind of deal with things, I think it does settle down a little bit, but especially within romantic relationships or friendships that you spend kind of a lot of time in, it can be kind of draining for someone who's neurotypical just because you think differently. You don't understand, the way that their brain works and the way that they're thinking about and responding to things in the same way you are. I think, people with ADHD often hyperfocus, and if a partner's trying to get their partner's attention and they're hyper-focused on whatever task they're doing, they might be irritable, and that might not be something their partner likes. They also might, be so focused that they forget to eat and, kind of feeling neglected or underpaid attention to. But then there's also kind of maybe sometimes if your boyfriend's telling you a story and you're not interested, that might become noticeable. You might not be able to fake attention as much as someone else might be. So I think there's a lot of ways it can impact relationships. And I think communication is just key, and also being aware of yourself and the ways that you kind of, maybe the differences you have that might be necessary to kind of talk about, so that you can make sure you're both on the same page and you're not feeling any sort of way or they aren't, and kind of meeting each other where you're at, even if there are differences.